An exercise ECG is a dynamic way of seeing how the heart responds to stress. The procedure involves the patient walking on a treadmill. It's a walk rather than a run or a jog. But every 3 minutes, the treadmill gets a bit steeper and a bit faster, making the heart work a bit harder gradually. The idea is to see what happens to the heart and to the patient as the patient exercises. It's a physiological way of seeing what's happening to the patient, rather than doing all the tests with the patient at rest. The ECG is quite a sensitive way of looking for signs of strain on the heart. The electrical cells of the heart are very sensitive to changes in oxygen and blood supply. And if you have a narrowing in one of the arteries that supplies the blood to your heart, one of the first places you see signs of trouble is in the shape of the ECG traces. As the patient's walking on the treadmill, we look at the ECG constantly and monitor the blood pressure and the symptoms of the patient, providing a good example of exactly what's happening to the patient as the patient's exercising. On the treadmill, we're looking for specific changes on the ECG. There is changes in the shape of the trace called ST segment depression that, if present, is a highly specific indicator for the presence of narrowings in the arteries of the heart. We're also looking for any changes in the patient's blood pressure that might be inappropriate. We're looking for changes in the rhythm of the heart, and we're monitoring the heart constantly during the test. Apart from mechanical issues with the treadmill, the risks are very small. We monitor the patient's ECG and the blood pressure in their recovery phase, and the results are available immediately for interpretation.